Hi, I'm Dr. Mark Lamantia.
And I'm Dr. Stephen Giannopoulos.
Today we're going to talk about nutrition and bone health and what action steps you can take to improve your quality of life and your body.
And can supplements and nutrition actually help scoliosis and why? And that's a question we've been asking for a long time. My specialty is functional medicine and nutrition and supplementation. And of course, Dr. Mark and I both are in the neurology field, and we recognize that there's a biochemical component to scoliosis, there's a neurological component to scoliosis. You know, my journey in this started with my mom. My mom had scoliosis that went undiagnosed for many years. And around the time that I was graduating from school, she actually had spinal fusion due to spinal stenosis. What happened was the curve in her spine caused her bones to degenerate fast. And she went to the doctor over many years and was told she had osteopenia, and then it became osteoporosis. She had arthritis and degeneration. Her bone density was around negative 2.4 on her T-score. 1 year, it jumped to negative 3.2. Her doctor immediately wanted to put her on the osteoporosis medications that are out there, and of course she asked me if this was a good idea. And you know, the problem with a lot of these osteoporosis medications is that they give you a better score on your test, but they actually can create more brittle bones.
They don't help create new bone. They just stop the excavating of the old bone, which is actually an important part of the metabolic process of renewing bone. If you don't excavate out the old and dying tissue, your body's not genetically programmed to lay down new bone. And so I think that most of our patients want to know how they can incorporate nutrition, supplementation into their lifestyle.
And that's where I jumped in, because with my mom, I didn't want her to suffer the consequences of taking that medication if we didn't have to. So we agreed with her physician to try something different for 6 months, and we altered her diet. And most important, when I came to Dr. Mark and I said, what research do you have not only related to scoliosis but also to bone health, because we know that scoliosis and bone health are intimately related. And we did a bunch of research, and I said, let's put these nutrients together. And we went and got a whole bunch of different supplements for her to take. We changed her diet a little bit. It's hard to change an old Greek lady's diet, but we changed it a little bit.
Lots of dalmades, spanakopy there.
And it was tough for her. She had to take her supplements at certain times, and she had to take certain amounts, and there was a lot of them, and the dosaging was kind of tough. But she did it. And after 6 months, she went from negative 3.2 on her T-score back down to negative 2.6. Something that is a kind of unheard of, even with the medications. And what you were saying before about the excavating, if we can just kind of tell our audience, bones are living tissue. It's not like the legs on your table. Bones are living tissue. All of the cells in your bones, they have to be replaced. There's a constant turnover. We estimate that every 14 months, every cell in your skeletal system is completely replaced. And what the medication does is prevent the old cells from being taken away and new cells from replacing them. So what happens is the old cells are prevented from being taken away, and they just get old and brittle. So the T-scores improve, but they have more brittle bones, which is why there's no evidence that these medications can reduce the incidence of fracture.
Right.
So that's the big problem.
And for a lot of our patients or parents of our patients, something that we didn't realize in the past was that not only do adults have a problem with bone density, but so do adolescents. And studies show that about 30% of adolescents with scoliosis have low bone density for age. It's not called osteopenia or osteoporosis at that point because they haven't reached their peak bone density yet, but when compared to age-matched norms, about 30% of our patients with scoliosis who are adolescents have low bone density for age, and you know that warrants management. We don't want to leave that alone because to complicate that, studies show that low bone density is a risk factor for progression. So we needed to find a way to help mitigate or reduce the effects of that in our adolescent population. and I think that's partly how we brought, our kind of our two practices together to try and figure out what we can do to what information we can give to our patients so that they can start to protect their bones even at a younger age.
Yeah, and what's interesting about scoliosis is that the abnormal forces that you have on your bones make you more susceptible to degenerative changes or arthritis. And one thing we know about this bone formation process is that there's multiple components. We found that there's hormonal components, there's inflammation components, there's what we call micronutrients that have to be addressed. So when devising a plan for my mom to take those supplements, we had to address all of those, and we did, and it was very successful. And then you and I sat down and said, well, why do we have to go buy all of these different products and have it be so difficult to take them? Couldn't we put them all in one, or what turned out to actually be two products that people can take, one in the morning, take the other one in the afternoon or the evening, and have it be something that's not a chore. So when we were developing the supplement protocol for my mom, I reviewed it with their doctor because that's the right thing to do, and she said, well, where's the calcium? I'm like, there's no calcium. There's no calcium. There's no reason to have calcium. And one of the problems we saw in the research with calcium is that people who take supplemental calcium, first of all, we live in America, and there's no shortage of calcium in the American diet. Osteoporosis is not a deficiency of calcium. It's you're losing your calcium, and preventing that is what we're looking to do. If you take supplemental calcium, what the research shows is that it can deposit itself in places you don't want it to deposit, like your joints, resulting in degeneration and arthritis. You can deposit it in your blood vessels, causing atherosclerosis and poor blood delivery to the smallest blood vessels in your body, which is your brain. And that's the last thing we need, is to cause
soft tissues. It could be in the muscles, it could be in the prostate in males.
Bone spurs, all of those things can be formed with all of these, all this excessive calcium.
Calcific tendinitis, things of that nature. And one of the main ingredients that we recommended for her was strontium. Mm-hmm. And strontium is a metal on the elemental chart, just the way calcium is. But strontium has been shown to have a greater affinity for bone to build new bone. And there's actually studies that showed that when supplementing for 3 months with 680 milligrams of strontium, that these patients were able to increase their bone density.
About the inflammation product, Inflamifex it's called.
Yeah, so basically what's a concern to us is that inflammation, the immune inflammatory response, is responsible for not only the loss of bone and pain, but it's also responsible for the deformity of the bone in growing spines. And so trying to interfere with that is very, very important. And what we found is that certain natural products like curcumin or turmeric have been shown to effectively interfere with the pro-inflammatory cytokine cascade, and that's just a fancy way to say the immune inflammatory response.
Now, Univestin is a patented combination of two botanicals, and these botanicals are very well researched in the anti-inflammatory world because of the research done on them in the anti-cancer world, but their effect is anti-inflammatory, and they're very powerful. The research is really wonderful on this, and it allows us to put the claims that we put on our bottle, that we can say may enhance, may improve flexibility, may improve, decrease pain, may, all of the claims that you'll see on our label, we're allowed to put there because the research has been done on this patented formulation called Univestin. We paid to put that in there because of how impressive that research is. And what I like to do, you could take the powder, put it into a glass of water, shake it, and drink it. What I like to do is heat up some unsweetened coconut milk or almond milk, get it nice and hot, not necessarily boiling, and then I'll use like a whisk or one of those battery-powered stirring, frothers.
Right.
And I make myself a latte. And
delicious.
It's got a nice sweetness to it.
Right.
And after dinner, we take our supplements so quick, you just pop the pills in your mouth and you swallow them. This
right?
makes taking your supplement at the end of the night almost like a ritual, where you would have this wonderful golden tea, I call it,
dessert.
the turmeric product, like dessert, because there's a sweetness to it in the coconut milk, and it's just a nice way to end the day. You know, by this time in this webinar, you should be wondering, well, all right, so do I need this? Should I be taking this? You may not have that answer by now. If you do, then by all means, you can purchase it on our website, or if you want to know a little bit more about your current state of health, if you want to have your blood work looked at, if you want to talk to one of the doctors, there is a link on the Serene Labs website or on this page where you could schedule a 15-minute consultation at no expense to you to kind of ask those questions we may not have answered in this webinar. And again, by all means, you can go ahead and purchase right off of this page if it's something that you wanted to do. But you might be unique, we don't know. And that's something that you can definitely schedule a time to speak with us about.
Right, and I think it's a great idea to have your blood work done and have bone density scans done and help use that information to help guide, what our recommendations are going to be. You can make a short phone consult or schedule to come in and have an in-person consult as well.
Yeah, that I think is a great idea as far as moving yourself towards a solution, right? If these are questions that need to be answered, we believe that we can also advise you on some dietary changes that you can make that would enhance and support. Look, if you're eating terrible foods and
right, then it'll be easy to make changes because there's a lot you can change.
And there's a lot you can change, exactly. But the supplement themselves is not going to fix everything, right?
Right.
It's lifestyle, so the lifestyle changes, usually they're subtle, they're not very big, it's not too much of a big deal. But some lifestyle change coupled with these nutrients really is the formula for improving your bone health, body health, reducing inflammation, reducing pain, improving flexibility, all of the things that we're all looking for.
Yeah. So we look forward to hearing from you and look for our next podcast coming soon.